forensic investigators, the Department of Employment and Labor inspectors, City of Kurleni Fire Department, and our own departmental internal investigation. The Accident and Emergency Unit remains closed until further notice, until the area is restored and the prohibition notice is lifted, because at the moment you can see the area is prohibited. No one is allowed to get into that place. There is a business continuity plan in place to ensure the continual functioning of the hospital despite the incident. And HOD, I think you remember I have been indicating to yourself and the team that all the hospitals, we must have the business continuity plan, which at least we have. Because should we not emphasize on that, we'll be having it now. We'll be experiencing a problem of this magnitude. Now we know when there is an incident, we know where we go and where to work. So the hospital remains on divert for ambulances. Walk-ins will still be seen at the hospital. So that's the emphasis that we want to do again. Anybody that has been stabbed just across the street, we will not take that person and say go to another place. We will still see that person. There is a team already that we have assembled, that with the doctors and nurses and other colleagues that allied, that must look into immediate cases of the walk-ins that will come to the hospital. So no one will not be seen when they come to the hospital. Then we can indicate then where that person must go. So even if we are still waiting, but there are those measures that we have done. And I know there were conflicting messages out there. People think that the hospital is not operating, nobody will be allowed in the premises. Various services such as the acute ill patients, mother and child services, mental health, and other chronic diseases will continue to be rendered at the designated places, because we have clinics inside the hospital that are operational. So those clinics will still operate as they have been operating. The fire has been extinguished. The other parts of the hospital continue to operate normally. However, the hospital remains on divert and is not receiving new emergency cases for now, but except with the exception of those incidents that were indicating that when there is a need, we can't say go away, we can't help you. The team is on site to immediately do that, and then we can take you to another specific area then. I emphasize that the origin of the fire is still under investigation. We await the official forensic report, and we will continue to keep the public informed of all the findings. All of us will be operating around Tembisa, including myself. I will be in Tembisa on daily basis so that we are able to support the team, we are able to deal with cases that come immediately in the hospital. So let me take this opportunity once again, thank the teams on the ground who have worked tirelessly since the incident of fire. We understand the disaster that this incident may have caused to staff, patients, and families. We will restore the damaged unit, we will continue to care for our patients, and we will continue to communicate openly and honestly as we recover. Thank you so much, colleagues. And this is the end of the briefing, Taladala. I'm handing over to you then.
Okay, no, thank you, MEC Premier. So, colleagues, that was just to give you, I think, the latest update. I'm sure that there would be some maybe follow-up questions that the colleagues might have. What we'll do is that I'll allow maybe just 2 rounds of questions. I'll request that you indicate if you've got a question, then we know you just indicate the media house, your name, and then you'll just project a bit, because we've got moving traffic outside, and then we'll allow the principals to be able to respond. And where there are technical issues, we've got the officials that are dealing with the details in terms of the technocrats. They will also allow them, if there are technical issues that they need to respond to, for them to be able to clarify that. Can I see if there are questions that colleagues have? Okay, I can already see a hand. Okay, you can go.
Just 2 questions. With the patients that had oxygen tanks, what happened to them last night? Where are they exactly? And then the second one, you mentioned the business continuity plan. What is that? Can you just explain in a bit of detail?
Okay, I think that's the main question. I think the first question, the acting CEO can probably respond, because it's a more clinical question in terms of treatment of that. Maybe
Dr. Luka,
the acting CEO. The question is around the patients that were on oxygen and all those things. What happened to those patients in terms of the treatment around that?
Yeah.
Good afternoon. We can safely say that as the MEC indicated, all the patients were safely evacuated from the area. So everybody was taken immediately to the ANC area where they were taken care of. There were 3 patients as indicated that needed special care and specifically oxygen. So 2 of them went to intensive care and 1 was sent to high care immediately. So they were taken care of.
The ANC area is the antenatal
Yeah.
clinic.
Not the ANC, which is an organization.
The beautiful.
On the business continuity plan, I like it so much. You ask me something that I like, I can get 10 out of 10 if I'm writing exams. HOD knows now, hey, lo mama uzokhuluma ngale business continuity plan meeting. I have been emphasizing the issue of business continuity plan because it's a contingency plan. In case there is a disaster, you must have exactly places that you identify that can operate the same you are operating if an incident of fire happens. So for me, I was happy that at least it's something that we have now. As I'm talking to you, we went to look for a place that, as much as it's not big, but it can accommodate the work that we've been doing on the other side where there was fire, because it's an emergency area that we've created. So business continuity, it means that you will, all the staff that have been there, all the work that was done will continue in that specific area. So already HOD and the team were showing me that these are the specific areas that we're going to do the same work that we're doing that site whilst we're renovating the place without going outside. But in some cases, you even go outside. For example, there's the clinic, a Sangweni clinic. If a Sangweni clinic is able to accommodate some of the work that we are doing, we are going to take some of the patients to a Sangweni clinic. So it's one area that we've earmarked again, so that when we have more patients, then we'll have an overflow at a Sangweni clinic. And I want to thank the team again, Talatala, because already a Sangweni clinic, we prepared it as if we know that we are going to have a disaster in the hospital. Because we're renovating the wards, especially mother and child area. So we're renovating quite a number of, in fact, I was saying to the team, to HOD and the team, please make this clinic like a private clinic so that when there's something happens, it's easier for us to take people there. It must have the 5-star feel. Anti-private hospitals have the 5-star feel. It must have that 5-star feel so that when people go there, they don't want to come back to Tembisa. And that's what we've been doing now, because it's one area that we've earmarked for business continuity so that the business of the hospital can continue. Thank you.
Okay, if I can check, the 2 hands, yourself, again, just project, introduce yourself, the media house you represent, and then your question.
Well, thank you, Kamon Panero from Tembisa Online. Just your observation, we saw a lot of people coming in. Obviously, they've heard the news that the hospital is on fire. Were you able to cope with the influx of the people, the numbers that came in to see their loved ones?
Okay, then maybe we can respond, then we take the next question.
We managed to cope because remember it's visiting hours, so they know exactly where they should go for their patients. And then those that knows that their patients were still at the area that has been on fire, they were told where to go, as CEO was indicating where was the place. So there were clear directions, even to the security guards, that when the families come, they must find their loved ones in the right places. Some were calling, by the way. It's not only visiting. Even yesterday, some were calling. They wanted to know what's happening, and they were briefed properly by the CEO and the team in every area, including the matrons were busy trying to make sure that they normalize the environment. Because they fear of the unknown was always there. When something happens in an area where you have left your loved one, you are always concerned as a parent or as a mother or as a brother. So they came to see their families, and I think they are happy.
Good evening, Masha Moyana from Health. You mentioned that there were 81 patients. Like, ordinarily, is this a number that you ordinarily have in the emergency ward, or was this maybe a number that you don't usually have when you have more patients? Like, what's the...
I think the
On
CEO,
average, how many
The CEO is going to
patients
deal with
you
it.
usually have in the emergency ward?
The CEO can respond to
Yes,
that.
yes.
Yes. Yeah. In terms of the numbers that we usually see, it is round about 80. It sometimes can differ from 75 to even 100. So 81 was a good average. So it wasn't, the busiest evening, but that is more or less the numbers that we've seen and we've managed. Yeah. And
Casualty is not a ward. Casualty, it's a casualty, it's not a ward.
well, and remember, it is in A&E, so it's accident and emergency. It's our casualty. It's not in a ward. This is where we see those patients, and this is where we've seen them. We've just taken them out of that area to a safe, open place, so that we can then manage them from there as a result of the fire. But otherwise, it is in our casualty that we've seen them.
I think there was a follow-up. Okay. Were you following up?
Are you able to tell us what exactly was affected? Without going into details, but are you able to just tell us what is burnt?
Yes, actually, can you respond?
And I think it's the same information we provided. Good afternoon. The area that's banned is the accident and emergency unit. So we will receive both the medical and trauma patients. And of course, in that area, there's receiving patients. You have also the area where you are registry, where patients get registered and mobilized. It's confined to one area. The area that is being identified for contingency plan is just down the road from there. It's actually in the same area, so that the same services can be provided. Literally, it's less than 50 meters from that area. So what we are worried about is that there's equipment, high-tech equipment that will have been affected, and of course the roof will have been damaged on a face value at this stage.
Okay. I think I don't see any other hands. Thank you very much, ladies and gentlemen, for your indulgence. I think we'll continue engaging, and as the MEC and acting premier has committed that as and when there are significant updates that we think are of public importance, we will continue just giving those announcements, maybe just continue monitoring the various platforms for any updates. And I think the team is available as well, where they are clarity-seeking questions. And I think the statement should probably already be circulated. You should probably have it already from your phones. Thank you very much. Principals, thank you very much.
Thank you. Thanks, colleagues.
Central one TBA, and then let's see, one of the where it's hard to get in Kikila. Naraka Rolo and Narakan, it means like so all the things. One of them know what's it's yeah. So I think we should take this route. Yeah. Let's get it. So we got this.
We wanted our own.